அனைவருக்கும் இனிய மாலை வணக்கம். Panelists, you are ready?
Yes, sir.
Can I have the slides of the speakers? இது எது தரணும்? Okay. We have got two wonderful ladies for this panel discussion. Dr. Jayashree Ashwath, a consultant pediatrician from Coimbatore. She is expert in pediatric allergy and asthma, speaker at various schools and colleges. She's got the Active Pediatrician Award in 2019. Next speaker is Dr. Lakshmi Shanti, PGDAP. She's a medical officer in Coimbatore Corporation, and she's an expert in adolescent health, and she practices adolescent health medicine, treasurer in IAP and AHA also. She is the secretary of AHA Coimbatore. So we'll go to the topic. The parenting is an art, and you have to mix it with scientific nuances and advancements, and this parenting today's adolescent is the most important and challenging task of any individual, be it amma or appa. Both of them are really puzzled in today's world. So they are anxious. Today's parents, they don't know. When they are encountered with the adolescents, they are really anxious a bit. When they ask them shot back at the parents, they are really petrified actually. So counseling the parent is important. You know, in pediatrics, a successful pediatrician is one who counsels the parent. So here we must know about parenting today's adolescent in this digital age. Start moving. So there is a generation gap. We have seen the families have shrunk from 1960, now it is 2021. The family size has shrunk, and now you see the high-tech gadgets have come. So we are all disconnected. So why is parenting a challenge in today's scenario? Dr. Jayashree will tell us about it.
Good evening, all of you. First of all, my heartfelt thanks to Puduvai Pedicon organizing team, Dr. Aram Chandil, moderator of this session, for giving me this opportunity. Coming to the question, adolescence itself is a phase full of challenges, as you all know. Going through this phase is as much a challenge for adolescents. The same way, parenting adolescent is also equally challenging. During this phase, adolescents go through a lot of not only physical changes due to puberty, but mental and psychological changes along with emotions. So this is a phase of roller coaster ride for an adolescent, and so also the parents. So parents need a complete understanding of all these changes which are happening in the adolescent children. Coming to the present day, we live in a digital world. The whole scenario has changed, moving from generation X to Y, and then the millennium generation, and followed by Gen Z. Adolescents look at parents as role models. So it becomes even more important that parents exhibit their best of character and creed. And the media exposure to internet right from childhood age, the shrinking families, single parent, single child, these are some of the challenges that the present day parents face.
Yes, you have brought it down beautifully. You must know that actually parents and adolescent, they learn each other one by committing mistakes rather than positive aspects. So what are the different parenting styles, Dr. Lakshmi?
Good evening.
As you know, there are 4 styles.
Good evening, one and all. At the outset, I would like to thank the organizers for this wonderful show and giving me this opportunity. So, நம்ம பார்த்த மாதிரி நம்ம சூப்பர் ஸ்டார் ரஜினிகாந்த் வந்து அவர் 2 குழந்தைகளை என்ன ஸ்டைலில் பேரண்ட் பண்ணி சக்ஸஸ்ஃபுல்லாக பண்ணாங்கிறது we all saw. But as a parent, each one of us here in this audience, we follow a different unique style. But all of these styles conform to 4 basic things. So these 4 styles have been explained by a famous American psychologist, Diana Baumrind, and she has classified this into 4 different styles based on certain characters. The first one being the authoritative parenting. Next slide. So this parenting style involves being warm and responsive and setting clear rules, but at the same time the parent has some expectations. So the only difference between this and the other parenting is that the parent supports the child in all the ways. At the same time, there are some rules which the child has to follow. So in this, which is the most balanced form of parenting, the associated outcome in our adolescents has been very good. So they have been academically good and better social skills and less of other mental issues. The next one being authoritarian parenting before, sir. So authoritarian parenting is nothing but, simply put, it's the military style of parenting, where the discipline comes first and then the love and affection comes later, meaning the parent sets up rules where he doesn't explain the rules. So the adolescent, he develops a lower self-esteem because of the constant disciplining and poor social skills and other anxiety issues. So the next 2 styles will be explained by Dr. Jayashree.
Yes, Dr. Jayashree, about permissive and uninvolved parenting.
Yeah, so as Dr. Lakshmi said, Diana Baumrind created 3 styles of parenting, and later on, by 1980 onwards, 2 other scientists, Markova and Martin, modified it into 4, including permissive parenting and neglectful or uninvolved parenting. Permissive parenting, as the name indicates, the parenting style is very lenient, very indulgent, and it is mostly child driven. So the child seems to be the boss, as you see in this picture. So obviously the outcome is going to be an impulsive behavior from the child, especially when they grow into an adolescent. They are going to be rebellious and they would not accept an answer no for anything. So because of this, ending with poor social skills, and this can lead to relationship problems later. Coming to uninvolved parenting, this parenting style is most often seen in the high achieving parents. We might include doctors, people working in IT sectors where both parents are working hard for long hours. The child is left with the IMA or some caretaker at home. So this kind of parenting is called uninvolved parenting, where we may not have time for the child. So no rules are laid. The child is given a free hand on most of the things. The relationship is a cold and unresponsive relationship. So these children lose track on how to deal with things as they grow older. So in turn leads to an impulsive behavior and social problems like delinquency, getting into habits like alcohol, drug abuse, and so on. So this is uninvolved parenting.
So now we would have got an idea what type of, all the types of parenting. So now we will see that what type, you can usually analyze yourself, and we have given a common scenario, like how each kind of parent will react. That in this present day age, we have a 14-year-old girl in a conservative family coming home one fine day and asking her mother, can I go or sleep over at my friend's place? So now they will, the panelist will enact actually what type of, all the 4 types they will enact actually, and you will have, from the audience you have to tell what type of parenting. Can you do it? Both of you?
Yes sir, we will try.
So I'll be the adolescent and she'll be the mother. The first one.
So Lakshmi is the adolescent and I am going to be the mother. So
அம்மா 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 ப்ளீஸ்மா, நான் நைட்டை ஃப்ரெண்டு வீட்டுக்கு போய் இருந்துட்டு வரட்டுமா? குரூப் ஸ்டடி பண்ண போகிறோம், ப்ளீஸ்மா.
No. Enna Lakshmi idu? You know your parents. I am not going to allow you to go anywhere. Especially you are a girl. Before marriage, I cannot let you go and have a sleepover with your friend. Forget it.
What type of parenting is this, audience? Okay.
Authoritarian parenting.
You imagine yourself. Go to the next scenario.
Correct, sir. Nowadays, these scenarios are becoming very common, so that's why we... Correct, correct. There are other next
That we are bringing in the next slide.
authoritative.
This is for different styles of parenting. Okay, please proceed for the next one.
அம்மா எப்போம்மா வந்த வேலையிலேருந்து? எனக்கு ஒன்று கேட்கணும்மா. நைட் ஃப்ரெண்டு வீட்டுக்கு போய் நான் குரூப் ஸ்டடி பண்ணிட்டு வரட்டுமா?
லக்ஷ்மி, இப்போ தான் அம்மா ஒர்க் முடிச்சு வந்திருக்கேன். எனக்கு ஒரு ½ டைம் கொடு. We will sit and discuss this issue. Let us take a decision together. So I would like to find out, நீ யார் வீட்டுக்கு போகிற, உன் ஃப்ரெண்ட் யார், அவங்க அப்பா அம்மா கூட எனக்கு ஃபோன் நம்பர் கொடுத்தேன்னா I will like to speak to them. And once we are convinced that it is a safe place, so Amma wants to make sure that it is a safe and secure place for you, and then we can take a decision.
Wonderful, wonderful mother. What type of parenting is this? Not able to hear, sir?
Authoritative.
Yes.
Yes.
Next style.
Next two, I think it's the negative thing. We can skip it.
Okay.
Go for
Okay.
The only difference is that in authoritative, the parent explains and has a communication with the adolescent, which is more important in today's scenario.
So, we'll have go to a case scenario. Let us discuss a couple of case scenarios that we as pediatricians encounter in our daily practice and the ways to counsel them. The first case scenario is a 17-year-old teen boy brought by his mother with the complaints of aggressive behavior for the past 3 months. He's a school topper and of late is faltering in his studies. He's spending a lot of time confined to his room and his eating habits have become irregular. His father is a software professional and hardly spends any quality time at home. So, this is to Dr. Lakshmi. Yes.
Yes, sir. So, this boy is one of my patients. So, I saw him when he was like 17 in his 12th standard. So, we heard from Dr. Vijayarani ma'am about HEEADSSS assessment. So, I just classified this HEEADSSS assessment to show how parenting influences an adolescent's behavior. So, for this adolescent, the mother has been a very permissive mother and the father, he was a tech employee and he hardly spends any quality time at home. So this was two different contrasting styles of parenting, and this boy being an introvert and due to lot of academic stress, he went into gaming because his close friend is a gamer, and he went into a gaming and developed a gaming addiction disorder. Next slide. So this is what is comes under the ambit of problematic internet use, which has 5 different categories. I'm not going into the details because we are focusing more on parenting. Next slide. So just a small statistics, it's a very reported like 1 to 18% of adolescents are diagnosed to have this disorder. And we should also know that 12 to 17-year-olds are the largest consumer of internet porn. It is there everywhere, but it is only not reported or not brought out. And excessive use leads to loss of time sense, neglect of basic needs. This boy, which we were talking about now, he used to spend time in his own room, hours together. He doesn't come out to eat also. He has some breads or biscuit packets in his room, and he used to have this Nutella, a tin of Nutella. So he keeps eating that bread biscuits with the Nutella and drink some Coke or some soft drinks, and he used to spend hours of time in his room gaming. So finally, actually, next slide. So this, the child that we are talking about had to be treated in a de-addiction center in US. He was there for 6 months and then he was treated. So this is actually the real state of affairs that we are facing. So for parents, what we need to say is that they need to have something called the anticipatory guidance. So there are some signs or subtle things that they can look for in their adolescent children and recognize things like excessive use, constant references to gaming, reluctance to stop playing, anger, aggressive behavior, disruption of essential activities, and some physical effects, anxiety, mood swings. So these are some things that the parents can take note, and if they find such things in their adolescence, it is high time that they should consult a proper adolescent pediatrician or a psychiatrist.
So we'll go to the next case scenario. Dr. Jayashree will be dealing this. A 13-year-old girl brought by a mother with complaints of difficulty in breathing, 4 months duration. History of going out of house to open space to breathe better for more oxygen, and a history of headache on and off that gets better with sleep. Frequent fights with the mother for petty issues. Recently, the death of her grandfather. There is a bereavement in the family due to COVID. The last rites which they couldn't attend. What, Dr. Jayashree, what will you do?
So this is a adolescent who was brought by her mother during the first wave of COVID, and as you all know, at that time the restrictions were huge. So when the grandfather passed away in a different village, the family couldn't attend the last rites. The girl had not seen the grandfather for many months. So she started feeling lonely, she was depressed, and she could not reveal her feelings to the parents. The parents themselves were in a different mood, like father was upset himself and the mother didn't communicate well because she was occupied with many other things at home. Otherwise, in personal history, the girl is a cheerful child before this episode. She was upset only recently but unable to communicate. And coming to the peer group, she was a very socializing child, but unfortunately due to COVID, the child did not go to school, so she kept all these feelings to herself. And the parenting style was, father was upset, so uninvolved in the present scenario, and the mother didn't communicate. So in this scenario, after ruling out all the organic causes for breathlessness, a sudden onset of breathing disturbance for the past 4 months, we came to a conclusion that this child is facing an anxiety disorder. We got an opinion from the child psychiatrist as well. So coming to anxiety disorder, it's the most common mental health problem in children and adolescents. It is characterized by excessive irrational fear or dread in the child. So it manifests as psychosomatic symptoms like headache, palpitations, tremor, excessive sweating, stomach ache and vomiting and so on. So in order to screen children for anxiety disorder, we use something called the SCAD-R scoring, which is nothing but scoring for children in anxiety-related disorders, which is revised. So based on the questionnaire, which is applied to both the adolescent as well as the parents separately, we come to a conclusion of anxiety disorder. Mild to moderate cases can be treated with psychotherapy in the form of cognitive behavior therapy, and severe cases will require management with drugs. Especially SSRIs are considered the drug of choice. So this child, after 2 to 3 settings of counseling and cognitive behavior therapy, which was done by the child psychiatrist, she is doing very well now.
So, contrary to belief, actually in adolescents, anxiety disorder is more than 25 to 30% revealed by the SCAD assessment. So the warning signs will be child feeling nervous, restless most of the time, complaints as she said. So these things we must see in the adolescent. So do we have any techniques to ward off stress for teens and their parents? Let's see. So
yes, sir.
You, Dr. Jayashree, will tell about it.
So here the most important thing we do is counsel both the parents and the child. So we have to teach them certain de-stress techniques. Apart from counseling, we can also involve them in activities like sports, yoga, meditation, as it was pointed out by the previous speakers in the panel discussion, and also increase their communication within the family, so which has been given in this anagram of bounce back. So both the parents and the adolescent have to bounce back. So we can give them counseling like bad times don't last, other people can help only if you share. So communication is the key here, and nobody is perfect, and unnecessarily thinking about the same issue is only going to make things worse. So along with this, we can also do behavioral therapy so that they bounce back to normal.
Okay, what are the attributes of a good parent, Dr. Lakshmi?
So good, positive, effective parent, the foundations are laid down by these 5 A's. The first one being accepting the child as it is, not comparing the child with others. And second one is appreciation or empathy. Especially empathy is very important with adolescent children. We need to understand that they are going through a lot of changes. Adapting parenting to the child means, maybe if a parent is having 2 children, each child is unique, they have to adapt the parent according to the child. Attention and involvement, quality time, spending quality time with the child is very important. And last but not the least, action, being a role model, which is very important.
So in today's world, the teens need an updated version of parenting as they are always in the fast lane. Dr. Jayashree, what will you advise for this new age parenting?
So like the new age adolescents, requirements are also changing. Their capabilities, the type of career they choose, and the amount of stress they go through, not only from peers but also the digital world. The parents also have to sensitively attune. So this is called sensitively attuned parenting, wherein the 3 important components being positive engagement with the adolescent all the time, keeping the communication open, and supervision or guidance. These are the 3 important components of a successful parenting for the present generation. So this is the slide to show what will be the markers of positive engagement, where the respect mutually will grow, and supervision and guidance, where clear rules will also be laid, at the same time taking into account safety and well-being of the adolescent, and open communication gives opportunity to end conflicts and achieve the goal. The adolescent outcomes are also good when we follow these 3 sensitively attuning parenting skills.
So due to short of time, let us summarize, like rephrasing, we should not be judgmental in an adolescent actually. So how will you rephrase these things? We'll finish it off fast.
Yes, sir. So it's like the slide itself shows everything, because these are some common characters that the adolescents exhibit. They're always stubborn, demanding, argumentative. So instead of blaming them for their behavior, the parents can positively bring it in such rephrasing things. Suppose if they're stubborn, they can tell that they're willing to persist in face of obstacles. So likewise for all the other things. Next.
So what not to do? Is there any type of parenting which should be avoided? Say like, there is all terminologies are there, cockpit parenting, helicopter parenting, these are all what not to do.
So far we saw what to do. So what type of parenting should be avoided is named as toxic parenting. So where we should never compare our child to others, ridiculing the child in front of others, or also exaggerating our own child's success. That is also equally toxic like ridiculing the child. Inconsistent behavior from the parents at different circumstances, and also blaming the child for no fault. And more importantly, I think this is a highlight, not being available for the child physically or emotionally when they need us the most. So these things have to be avoided in parenting.
So rapid fire, a worried mother complaining that a 14-year-old gained weight post-lockdown, all in one-liner. Indulgence in junk food and excess screen time.
I
What
think
will you
in
do?
this scenario, role model by the parents is the most important thing, and the counseling has to be done with both the parent and the child together. We can use a chart like a traffic light signal diet and show them what to use the most in their diet and what to be avoided like junks.
Next scenario, Lakshmi.
This is a scenario where the mother finds a 16-year-old girl is sending nude messages. So sexting is a problem that we are facing. It's like a tip of the iceberg. So whenever a mobile is given to a child or an adolescent, the parent should have, they should supervise what the child is seeing online apart from the classes. And they should also know that sending nude messages or explicit texts comes under sexting and it is punishable under the POCSO.
Next scenario, Dr. Jayashree. One line.
So this is something which we are seeing now. I personally have seen 2 children with this athletic triad. That is why we wanted to put this. So whenever a girl is taking up sports or any kind of physical activity as her main performance, we have to ensure that she is getting adequate nutrition. So in fear of putting on weight, the girls start skipping meals or enter into disordered eating habits. They start skipping their periods, which is menstrual irregularity, and also they lose bone mineral density. So these 3 together form the female athlete triad. So we need to counsel the children who take up sports ahead to avoid this condition.
Okay, during COVID, this 15-year-old boy comes with a clean shaven head. Motta போட்டுட்டு வந்துறான் வீட்டுக்கு. வீட்லயே இருக்கல நானே எனக்கு போர் அடிக்குது. Lakshmi, what will you do?
So this is one common thing that even we as parents have encountered with our adolescent children. So not only clean shaving head, doing some funky haircut or tattooing, there are many simple things. So what we wanted to emphasize is parents have to choose their battles wisely. So these are certain simple things which we can give the child some autonomy to at least know about his hairstyle and then have a communication with him on why he did that. So we needn't argue more or blame him more.
Dr. Jayashree, do you agree?
I don't think so, sir. If it is my child, definitely I would have been an authoritarian parent here.
Okay, good. So 11-year-old has attained menarche. Her mother advises her to stay home for a week to follow certain rituals, but she refuses and wants to go to a school. So I think we will finish it off. Let us not go to the audience.
Yes.
Tell us briefly.
So this is the situation which has to be dealt with in different customs and beliefs. In the rural background, the children themselves might expect such functions for them. But in urban background, many a times the kids think this is a normal thing, why the mother is making a big fuss about this. So it has to be a collective decision with the child and the parent and decide whether such rituals is going to benefit the family.
The basic thing is, first, when the relatives should first congratulate her when she attains menarche. No one should comment. Unnecessary comments are not necessary. This, the mother, the relatives should understand. So, think any post in social media, think before you post. The acronym itself suggests it should be true, it should be helpful, it should be inspiring, if it should be necessary, it should be kind. Only then you post anything in social media. Otherwise, don't post. Points to ponder, Dr. We leave it. These are the final things. Khalil Gibran's famous quotation. Children come from us, but they explore the outer world more frequently and நம்ம 8 அடி பாஞ்சா அவங்க 16 அடி 28 அடி கூட பாய்வாங்க. Thanks for the opportunity.
Thank you so much.
Wonderful ladies have done good. All my appreciations to both of you. Please stay over for the valedictory function. I request stage management, please make the stage, please. Ideal, Vaba. Seri.
I request Dr. Adolescent